The financial crisis facing many home health care providers in Ohio, first investigated by Local 12 News, is moving into the political arena.
A liberal group called Progress Ohio is launching an online petition drive calling on Republican Governor John Kasich to, quote, start holding state contractors responsible. While some health care aides are finally starting to get paychecks after more than 2 months, others are still waiting. In a story you'll see only on Local 12 News, Jeff Hirsh digs into why the problem started in the first place.
And he's like part of my family, so how can you not come in and take care of him?
Joyce Thomas has been caring for Philip Tucker, a quadriplegic, for 14 years. And like so many other independent home health care providers, Thomas has fallen through the cracks of a new payment system called My Fiasco Ohio, which for many has turned out to be My Fiasco Ohio. Critics are not surprised.
If this had been a rocket launch, the rocket would not have gone into orbit.
Cathy Levine is the director of a consumer health activist organization named UHCAN Ohio. Her group says the state moved too fast in changing the payment system for patients eligible for both Medicaid and Medicare. The state of Ohio used to pay the health aides directly, but as of June 1st, insurance companies took over.
In Cincinnati, you have 2 managed care companies, each taking on maybe 10,000 patients at once. There's no way they could do that and not have collateral human damage.
People like Joyce Thomas.
Well, I understand that it takes time for something to go, for everything to start working right, but this is going on 3 months. I mean, it should have already been over.
Levine says the state should have started with a small test project, 500 to 1,000 patients, not the 100,000 plus now enrolled. On behalf of several activist groups, Levine warned state and federal officials it seems unrealistic that all the components of readiness will be completed and plans will be ready on day one. The consumer groups requested a 3 to 6 month startup delay.
We repeatedly asked the state and federal government to start out with a voluntary enrollment program so that they could work out the kinks before bringing in a lot of people at once. And we lost every step of the way. There was a great insistence on the part of the policymakers to do a lot at once.
Then it got worse. Many independent providers used a service called Rhino Bill to electronically file their timesheets with the state. According to UHCAN, Rhino dropped out of the new system without immediately telling providers, who then had to start over with other billers.
So right there you're talking just 3 to 4 weeks just to get your name into a system, and you're not getting paid.
One of the big problems with the current system is that nobody really knows how many people are being impacted by it negatively. That's one thing I've heard over and over. How many people are not being paid? How many sick people are not getting the services? And the problem is the state doesn't know, they're not keeping track of it. And if the insurance companies know, they're not letting it out.
If it turns out that it's only out of 115,000, 3,000 people who are having terrible problems, is that unacceptable? 2,000 people is unacceptable. 1,000 people is unacceptable.
There is some good news for Joyce Thomas. 2 days ago, she received a $400 cash advance from Aetna Insurance.
And I was able to get my medicine and put gas in my car.
But Thomas says she's owed $1,600 more, which grows each day she takes care of Philip Tucker.
They were promised, and we hope they'd get better care than they had before. Right now, you know, we're in damage control mode.
And you just want to scream, you know. Why me?
The state of Ohio says 5 health plans involved in My Fiasco Ohio have paid more than $100 million in claims since the program began. The state says Aetna, the largest plan in our area, has paid nearly 90% of its claims within 30 days, but we still keep hearing from people saying, hey, I'm waiting. A number of independent providers like Joyce Thomas say they've gotten cash advances or partial payments. Some people have gotten full payment. An Aetna spokesperson says they are working to speed things up and in some cases have made overnight payments to people whose names we have provided the company. I also called Rhino Bill, the billing company we mentioned in the story, but Cammie, nobody there. called me back.
What a mess. I mean, of course you feel bad for the patients, but your heart really goes out to these providers who, like all of us, they have families to take care of, they have bills to pay. Have any of them either quit or talked about quitting?
Oh, I think they've all talked about quitting.
Yeah.
And I've heard some that have quit, but most of them say they're so dedicated and devoted to these patients. Like she said, she was 14 years in my family. It's like, I can't leave.
Yeah.
But some people have quit, absolutely.
I really admire their dedication, but I also understand if they have to quit.
They got to eat.
Yeah, exactly. All right, Jeff, thanks. Aetna Insurance, by the way, has established a phone line for healthcare providers having payment problems. And here's the number for you. It's 1-855-364-0974. You can also find a link to Aetna's website at local12.com.